Sometimes this is not working. Oops. So, as part of the All India Coordinated Research Project on Ethnobiology, a team of scientists conducted an ethnobotanical survey of the Kani people in Trivandrum, and in 1987, they found, as they were moving around, they found that these Kani tribes who were taking them around were not having any exhaustion, in spite of not eating anything. And these scientists were very soon completely tired and fatigued because they had to climb the hills, go deep into the forest. And then these Kani tribals gave some fruits to these scientists, asked them to eat that. And they found that after eating those fruits, they also became very energetic. So the fruits gave the researchers a boost of energy when consumed. So initially the Kani tribal said, we cannot disclose this information. You will all start making products and selling it. It is not meant for that. Then our forests will get destroyed. Everybody will come here and start. But eventually they had a agreement with the Kani tribe. So this was a good example of how traditional knowledge can be used to even create a market approach. So they identified this plant as Trichophis zeylanica, and then they created an idea. The TBGRI developed with CSIR, Jammu lab. They did a lot of work. They identified compounds in this, and they found that it has got an adaptogenic property. The problem was that this is something nature also does. Nature is not for mass production and commercialization. So the fruits, it's not feasible to produce fruits in such a large quantity. So the product that came was a little inferior to what the tribes originally used. This requires a microclimate also. You cannot grow this plant everywhere. So this was a special gift for the Kani tribes by the Agastya Malai itself. It was to meet their requirements. But as we humans are greedy, we wanted to use it. But it's still a good example. They developed this into a product. So extensive research was done at the regional research laboratory in Jammu, and they proved that this definitely has an effect to reduce weariness. And what they did is they realized that the fruit cannot be used, so they used the leaves instead. So the actual medicine was developed using the leaves of this plant. It's not as potent as the fruit, but still it came out into the market. And AVP, Ayurveda Pharmacy in Coimbatore, actually took the commercial license to sell this. And the whole idea was that this proceeds would go to the Kani tribal. So they would also get financially benefited. So it's a very good arrangement, but this got into a lot of controversy. There were so many activists, and so this whole thing eventually did not work out the way it was anticipated. Dr. Pushpangadan was under the scanner. He was accused of misappropriating traditional knowledge, exploiting it commercially. There were questions about whether the Kani tribals were being adequately compensated. But still, in a low profile, that product is still circulating in the market. But what could have been taken to another level? So, all these things require more awareness. Unless there is more public awareness, so these kind of possibilities are lying hidden in the field of traditional medicine. And this is not even Ayurveda, it is tribal medicine. And that is what I want to bring your attention to. When you say Indian medical heritage, it is not just about Ayurveda. Now another point is the global herbal market. See, the global herbal medicine market was valued at $151.91 billion in 2021, and is poised to grow from 168.86 billion in 2022 to 437.59 billion by 2030. So now the thing is, what is a paradox here is that this is another reason why we should bring Indian medical heritage to our own people. See, European Union is the biggest market with a share of 45% of total herbal market, even though all the raw materials come from countries like India. North America accounts for 11%, Japan 16%, Asian countries 19%, the rest of the European Union 4.1%. India has 16 agroclimatic zones. 10 vegetative zones, 15 biotic provinces, 426 biomes, 45,000 different plant species, 15,000 medicinal plants. 7,000 is a bit of an exaggeration here. Strictly speaking, in Ayurveda, we have only around 1,000, 1,200 plants. The rest are coming from other folk and local traditions. So this makes India one amongst the 12 mega biodiverse countries of the world, which though it has only 2% of the total land area, it accounts for almost 8% of the recorded species of the world. India is unique not only for the biodiversity, but also for the traditional knowledge that is associated with that biodiversity. So on these two counts, India becomes a very big potential place for the development of traditional medicine. But India's share in the global herbal medicinal market is a minuscule 0.5%. So with this potential, this is how we are performing. So if we can go from 0.5 to 10%, you can just imagine what it will do to our economy, what it will do to our GDP, how the whole picture will change. So are we really using our own potential to solve our own even financial problems is a question. So unless we invest, unless we really, bring this into our advantage, we cannot move forward. Another area that I want to bring attention, the speaker who was there in the morning, Dr. Kumar, he's from a university in Bengaluru called Transdisciplinary University. And there they did a very simple innovative work. This is Dr. Padma Venkat. Earlier she was there. She was one of the directors of TDU. Now she is with SRM. I think she left from there also. She's a very renowned scientist. So what they did was to develop an indigenous water purifier. It's nothing, it's just a copper vessel. But nobody knew that it could have such an impact where water purifiers are not possible. She demonstrated how just using copper vessels we can, so this was field tested. You can see field tests were done with the help of Grand Challenges Canada grant with assistance from professors of McGill University. These tests were carried out in Kenya and India to demonstrate the anti-rotavirus and antibacterial effects of copper. It was found that there was a significant drop in the bacterial count in the water. Additionally, they also monitored the diarrheal incidence in Kenya and found out that the number of children under 5 years of age affected by diarrhea went down by 37% just after this simple water purifier was introduced. So you can see sometimes from traditional knowledge, the innovations that we get can be very simple, very cost effective, but can have wide, impact in the society. Now this is the study of these copper pots, and you can see viridium cholerae, so many, typhoid, paratyphoid, bacteria. Most of the waterborne diseases, that cause these kind of epidemic outbreaks can be controlled just by the use of copper vessel. So copper vessel also is expensive, so they made another innovation. Instead of using a copper vessel, or they developed a copper coil. Now a coil can be inserted into any bottle. So that makes, these are all very simple innovations. So instead of carrying a copper bottle around, you can just carry a coil and insert into even your glass and keep it for some time, and then the water gets purified. They also looked at how much copper will enter into your body, and they found it is within safe limits. The daily limit is there for how much copper can actually go into your system. So this is still within safe limits. So this is again an innovation that has been inspired by traditional knowledge. So now if you look at the Indian medical heritage, is diverse and consists of both codified and non-codified streams. So non-codified, this was also mentioned by Dr. Subramania Kumar. Non-codified is very vast, very rich, but we have to be careful. All of that in non-codified systems may not be acceptable. It is by trial and error that the system evolves. But what is interesting is that India had a system where medical knowledge evolved also from the general public. Today scientists believe only in things that are discovered inside the labs. But in old India, human life itself was considered to be a lab where new knowledge could be discovered. So they were always open to folk knowledge. I don't know how many of you are aware that Edward Jenner, when he discovered smallpox vaccination, that information was given to him by a milkmaid in Gloucestershire. So Edward Jenner was once asking this milkmaid when there was an outbreak of smallpox. She was happily walking around, and that Edward Jenner asked her, "How is it that you are moving around so freely? Everybody is having an outbreak." So this milkmaid said, "Don't you know that if you get cowpox, you will not get smallpox again?" So I have got cowpox. So this was common knowledge amongst the milkmaid women. And that Edward Jenner got all the credit for it, because he knew how to convert that into a technology, how to make that into a vaccination. So folk systems can also give you knowledge. In fact, in Ayurveda we say animals can also teach you. This is today called as zoopharmacognosy. So in Canada, I think in New Mexico University, so researchers observed that sparrows were picking up cigarette butts that were fallen on the ground. So they got a bit curious. Sparrows also started smoking or what? So they followed the sparrows. They found, of course, sparrows were not smoking. They are too smart to smoke like that, like us. So they were picking up the cigarette butts, opening it, taking the nicotine from that, and spreading it around their nests. And very soon the researchers realized that this was preventing pests from attacking the eggs of the sparrow. Now how could the sparrows know with one look that this cigarette butt has the chemical that can? So a human being, a scientist even, to discover this association would take maybe centuries. We will have no clue that this has a chemical, and especially it is the smoked cigarette. There is a change that happens to the compounds when you smoke it, and that is what actually works as a pesticide. So the Atharva Veda says that even animals can teach us. Garudo Veda Bheshajan, the Garuda knows the medicine. Nakulo Veda Bheshajan, the Nakula knows the medicine. So we looked at animals also. Today we know chimpanzees, even dogs and cats, they know how to self-medicate when they have illnesses. So folk systems were given a place in our old system. This was considered as a good point. Sometimes an observation of a patient may give you a clue for a disease. So we have to be open. This is how the folk system developed in India. So codified streams are more organized. We call it the Shastric streams. So when we look at traditional medicine, it's common that we put everything under one umbrella. So we have to realize that traditional medicine is also very structured and graded. We have at the lowest level, the folk systems, the tribal systems, and we have very organized systems like Ayurveda, which is Shastric, means which are having its own literature and other systems. Yoga is also today included as a medical system under the umbrella of Ayush. Without yoga, we wouldn't have that acronym Ayush. It would have no meaning. So yoga is of course more for wellness than as a medical system. It was not considered a medicine in older times. And we will be focusing more on Ayurveda in our discussion, mainly because I don't know much about the other systems. So this is a chart which shows you how Indian medical heritage is classified. So we have the non-codified folk and tribal, and the codified indigenous and naturalized. Indigenous systems, Ayurveda and Siddha, are very strong old traditions. Ayurveda with a more pan-Indian presence compared to Siddha, which is more in the Tamil Nadu region. Naturalized, we have Unani, naturopathy and homeopathy. I don't know where this works. Yeah. Now folk medicine in India, these are folk systems. We had a whole network. This made India at one point of time very self-reliant in healthcare. Everybody knew when there was a problem what is the first aid to be given. For most simple diseases, people never had to go to a doctor. And as we will see right now, the whole idea was how to avoid Vaidyas. Vaidyas, people didn't want to go to any Vaidya. There is a sloka in our tradition which says, Vaidyaraja Namastubhyam Yamaraja Sahodara. Yamastu Harade Pranan, Vaidya Pranan Dhananicha. Oh Vaidyaraja, my salutations to you. You are the brother of Yama. So even in those days, today also doctors are criticized for making money and sometimes killing the patients. This was common in those days also. So Yamastu Harade Pranan. Yama will only take away your life. Vaidya Pranan Dhananicha. Yama will never take away your money. Yama will not allow you to take your money with you, but he will not take it. But Vaidya will take both your money and your life. So India had created a healthcare system where Vaidyas, there was even a time when Vaidyas would be paid only if people were healthy. If anybody becomes sick, their money would be cut. Today we have created a system where medical professionals make money out of the sickness of people. So we have herbalists, elderly persons, sadhus, so many healthcare providers. It was a whole hierarchy. Vaidyas were maybe at the top, but we had a whole spectrum of people at different levels. Just like today we have paramedical staff, healthcare providers, ASHA workers. This concept is there. So this is the old system where everybody, even the grandmother was a real Vaidya in those days. They knew immediately what is to be done when a child becomes sick, and they also knew where to refer and take them to the doctor. So despite significant development of rural health services, village people still use herbal folk medicines, and for many common conditions they are still using it, but there's been a break in this knowledge, and today the problem is people are very confused. They don't know where to use this, where to consult, this. So we need to really bring in more education. So today the option is, instead of medicalizing everything and becoming dependent on very highly organized professional services, this whole system we could revive by giving education. The first responders. First responders would be, people in this hierarchy, and they should be empowered. They should be given even modern knowledge so that they know when to refer a patient for, advanced care. This could really fill a lot of the gaps in the current healthcare delivery system. So Indian household ladies, herbal drugs for most of the ordinary ailments. So many of this, like the use of turmeric, became so popular in India, not through just Ayurveda, because Ayurveda is prescribing it as some medicines here and there, but it is the whole women power of India that has boosted this use of turmeric across the country. So the use of fruit of Piper nigrum, the fruits of Trachispermum ammi, ajwain, asafoetida. So many of these discoveries were also made in our kitchens and homes. How certain spices could be used for certain simple problems like flatulence, indigestion. They were even discovered independently by people regularly using them through their observation, and later Ayurveda endorsed it. So in the villages, elderly persons, sadhus, ojas, priests, they also knew a certain herbal drugs. They were sometimes, these are the people who used to go very frequently into the forests. So when they come back, they come with all these jadi-bootis. And they had some special, medicines and formulations. And they were, see, at least one thing was that these people never charged anybody for their treatment. They did not have any other intention. So I'm not telling that we should go back to this system, but the whole idea is that have this whole hierarchy of, healthcare providers, first responders, and then, the whole system, so that we can address these gaps. So then traditional herbalists were kind of professionals roaming. They're a little bit more advanced, but they're still not Ayurveda physicians. Ayurveda physicians needed to study in a school. They needed to get certified. They needed to study texts. They needed to undergo practical training. So that was a very organized system. I'm talking about folk systems which existed outside, which catered to the primary healthcare needs of the whole population. And I want to give example of 4 things that were there in India, 4 practices. One is bone setters. They even exist today. In many, many villages, rural areas, when people have fractures, they go to bone setters and simply solve it. If the simple fractures, they heal quite well. Sometimes without the problems of modern, plaster of Paris, sometimes you have issues, malunion. Chiropractors don't really exist in India. These are actually bone setters. So they are specialized in dealing with sprains and strains and fractures, simple fractures. They can deal with only simple fractures, not very advanced. But then they are able to deal with a lot of day-to-day, problems. Then smallpox inoculation was also another thing which happened outside the tradition of Ayurveda. So people's initiative for their own health. This was there in India. Everything was not delivered by the professional medical system. Smallpox inoculation is not described in Ayurvedic texts at all, although smallpox is described. Then rhinoplasty, nasal reconstruction surgery. Today if you think of a surgery, you have to think of a big hospital, ICU, anesthesia. Now in Pune, potters were sitting on the road and reconstructing noses for people. This is the level to which technology was brought down to the common man. They just have a small cloth barrier. They sit inside. And the Britishers, when they came, they were so surprised. This led to the development of, this is even today known as the Indian method. So they learned plastic surgery not from Sushruta Samhita. They learned plastic surgery from a potter community. Potters were surgeons. So just imagine, when the need was there, the whole society adapted to it, developed the expertise, developed a system where a public health issue could be solved very easily. And even when European surgery, because India and Sushruta discovered the need for sterilization of instruments. So sepsis after surgery was a big problem in Europe before antiseptics were developed. So surgery was, as they say, more butchery than surgery. Whereas Indian surgeons, of course, we did not have anesthesia, but when it comes to use of surgical instruments, they were very advanced. It was not common for post-surgery sepsis was very uncommon in the Ayurvedic tradition. And the potter community also, they knew how to deal with these instruments. And so then we have the Dai tradition, what we call as midwives. It was a very strong tradition in India. So India has approximately 60,000 traditional bone setters who have no formal education or training in modern medicine or Ayurveda, but they treat 60% of bone related trauma. Please look at that. We do not know. So where in rural India, especially where a large part of the population lives in poverty and without access to modern medicine, traditional healers provide a much needed service, often without charge. So they follow a similar approach to diagnosis and treatment of simple fractures and dislocations as modern medical practitioners. They know quite a lot about these things. And so they are also willing to collaborate with Ayurvedic and allopathic doctors, but they generally look down upon as quacks. So here are some pictures of some of these traditional. One place called Puttur in Andhra Pradesh is very famous. In Tamil Nadu also we have, in Coimbatore there is a place. So a lot of people go there. And many of these practitioners now know when they cannot treat it, so they would also refer to a modern doctor. They will say in these cases surgery is needed. They have understood by experience what they can handle and what they cannot. Now then we have smallpox inoculation. India and China were two countries where this. So today a lot of questions about vaccines, whether Ayurveda accepts it or not. But this precursor of vaccination, we should not make a wrong claim that India did vaccination. Vaccination is a different procedure. There's a different, this is called as inoculation or variolization. Variola was another name for smallpox. So here the thing is, we take the pus from an infected person and then infect another individual, because after the infection that the germs would not be as strongly active. They will get a mild version of smallpox and then they would get immunity. Excuse me. Whereas, you know, smallpox is totally different. We are using the virus of cowpox, not at all smallpox. And because it originated from cow, all vaccinations are not actually vaccinations. Vaxa means cow. The rest of the vaccines are not from cow, but still they are called as vaccinations. So that's about terminology. So what we found again, when the Britishers came into India, they actually found a very robust system of healthcare existing in India, where with plastic surgery, inoculation, and all these advanced things. So initially their response was very appreciative. Many of them wrote accounts of interesting things happening in India at that time, which includes the accounts where two early English residents in India give descriptions of inoculations done by itinerant Brahmins. Their technique involved dipping a sharp iron needle into a smallpox pustule and then puncturing the skin repeatedly in a small circle to induce infection in a healthy person. And then they would get a mild, they have some dietary regimens to follow. And they observed that almost all cases which underwent this inoculation, they became immune to the disease. So this was especially practiced in the region of Bengal, the region that includes modern West Bengal, India and Bangladesh. And Howell, one of the Britishers who documented this, said that this looks like this practice has been around for hundreds of years. So early in the 18th century, variolation, referred to then as inoculation, was introduced to Britain and New England to protect people likely to be at risk of infection with smallpox. Now Chinese also did something similar, but their method involved blowing smallpox matter into the nose of the person. What we did was actual inoculation, very similar to vaccination. So this pocky matter should be carried at body temperature at a month before it is used. If that was not possible, it would be exposed to hot steam and various herbs. So both these processes would have damaged many of the smallpox virus particles, and thus the infectious load transmitted would be very variable. So there was some challenge in doing this type of inoculation. But what is interesting is that this idea of vaccination is not something entirely new. Many, especially in China and India, the earliest experiments of what we know as vaccination today had already happened. And this was not codified. No Ayurvedic text talks about vaccination. So this means that Indian medical system has also been evolving. It took many time. After a long time, what becomes established in practice then gets codified in the tradition. Now I want to just...
The name Sushruta embellishes the walls of the Wellcome Library, along with those of other great innovators in medicine and science. He was a surgeon who lived 2,000 years ago in what is now India.
Sushruta and his group were doing operations 2,000 years ago that were absolutely stunning. I mean, you'd think it was science fiction if we weren't sure historically that it was really that old. They were performing surgical operations that weren't discovered in Europe for another 1,500 years.
Sushruta's original manuscript is long lost. This copy deals with many aspects of medicine, but it's best known for its instructions on the surgical repair of a severed nose.
The need for Indians to develop surgery.
The injury was bad enough. 2,000-year-old technique.
He created a little three-dimensional bent foil pattern of the missing skin.
Dr. Menek has made a template to guide his scalpel when he cuts donor skin from Jana's forehead.
Sushruta basically did the same thing. They made a pattern of a leaf, placed it on the forehead, and then cut out an area of skin corresponding to what they thought needed to be replaced.
Sushruta's manuscript is concise on how to do the job.
So what he actually says in his own words from about 2,000 years ago is this:
When a nose has been cut off, I shall describe to you properly how it can be repaired. First, you take the leaf from a tree and make a template the same shape as the nose. place it on the cheek and cut from the cheek a piece of skin the same shape as the leaf. Work carefully, but swiftly.
In an age where there is no anesthetic, working quickly is very important because your patient is likely to be screaming. In fact, most of these surgical texts, the anesthetic is for strong men to hold the patient down.
Cutting skin from the cheek was not the end of the agony.
Then he scarifies the nose, that is to say, the stump where the nose was gets scratched and made bloody and ready to receive new tissue, and then this new piece of skin cut from the side of the face is attached to this scarified area.
To complete the operation, Sushruta devised a way to allow the patient to breathe. 2 tubes made of reed were inserted into the new nose. It was all held together by tight bandages until the skin grew into place.
Sushruta ends by saying, the physician who can do this, who knows this technique, is fit to repair, to work on a king. Ya evam eva janiyat sa rajnya kartum arhati. He is worthy to perform on a king.
Sushruta's surgical innovation has influenced medicine through the ages. His techniques were adopted by travelers and taken west.
The compendium that Sushruta created was well known in India, and it isn't until about the 7th or 8th century of the Christian era that we begin to hear that it's known in the Middle East and that there are Arabic translations of this work.
So there's more in to this video, but I just wanted to highlight that at that time in the West, in Italy, there was a very similar technique attempt, because cutting the nose, in this video Dominic is taking that it is a practice of punishing in India, but it was worldwide. Even in Europe noses were cut, but he doesn't mention that in this video. And there in Italy what they used to do was take a person's arm and then fix it on the nose, cut a piece of skin from the forearm and fix it, and then tie a bandage. And this would take about 45 days or so, I don't remember the exact number of days, for that skin to heal. And even after the healing has happened, so the arm will go to sleep in a few hours. So you can imagine after that you will need physiotherapy to again use your hand. And Dominic, actually in this video that portion is also described, but for want of time I didn't go to that section. The horror story was that after all this exercise, when the patient sneezes, the nose would come off. But so Sushruta's method was unique because it was an idea to use a skin graft very close to the point of the injury. So he used first from the cheek, but the potters were using from the forehead. They found that heals much better. And this was an innovation. And this method actually triggered the development of modern plastic surgery. And this all happened because a few potters were continuing this practice. So how a rhinoplasty in Pune back in 1793 became a model for European surgeons. And the European surgeons, if you look at Sushruta's surgical instruments, what he classifies as shastras and yantras, the sharp and blunt instruments, the yantras are actually devices. And we have the precursors of modern endoscopy, scopy, where you try to do invasively explore the interiors of the body. So all of these foundational things, the surgical instruments, are very similar to what even modern surgeons use. The shapes have been refined and some improvement happened, but the basic principles and basic approaches are still the same. So a letter to the editor published in the Gentleman's Magazine of October 1794 proved to be again a watershed moment in the history of plastic surgery, and especially in the field of corrective rhinoplasty. So what was observed was a native potter was working on an Indian bullock cart driver who faced a massive nose mutilation. The letter introduced the Indian method of nasal reconstruction using a forehead flap, which is different from what is there in the Sushruta Samhita. So what it indicates is that the text was not followed to the letter. I mean, people were innovating. Sushruta was advising to use the skin from the cheek, but the potters were using the skin from the forehead. And this is exactly what modern rhinoplasty surgery is also doing. The forehead flap is actually very proximal to the nose, and that heals much better. Now we have also the Dai tradition, traditional birth attendant, and they were highly skilled. I mean, they had but that knowledge has eroded, and now there has been an attempt. Actually, the implementation of Dai training has resulted in widespread improvements in maternal and neonatal health. So, of course, today we have more modern knowledge also. That integrated with traditional knowledge has really helped to, address a lot of problems in maternal mortality. So the occurrence of unsafe practices such as overuse of oxytocin, all these things, infection of umbilical cord has declined. So this is a good example of how our traditional healthcare resources, human resources, can be used in a better way to address health challenges. So these are all part of the folk tradition. We have not even come to Ayurveda. Then we have medical knowledge of the tribes. So Indian medical heritage is very diverse. The tribal settlements, there are many things are good, many things are bad. We have to take it very carefully. But they because of their close proximity with nature, they have a lot of deep insights about the biodiversity and how many of these plants can used for their day-to-day problems. And if you look at the whole spectrum of tribal knowledge that is available, it's not possible to actually compile and present that. It's so vast. People have done research on specific tribes. They have screened what medicinal plants are being used by them for what practices. So then a lot of the tribal communities in India have been screened, and what I have understood by looking at this data is that there's so much of diversity. It's not the same plants that are being used. Different regions, people use different plants. Sometimes there are convergences. This is a very interesting area to study, and with the help of Ayurveda, many of these practices could be validated. The safe ones and the effective ones could actually be strengthened, and then it would be a good. So we need more scientific research to separate the chaff from the grain. We need to look at what is really valid and effective. So this is another area and aspect of Indian medical heritage. India has a very rich and diverse tribal population, and they are suffering now. There are a lot of gaps in their health care. They are caught between modernization and living in their own traditional ways. Now, medicinal plants used in Ayurveda, currently only 300 to 400 medicinal plants are commercially used in Ayurveda. Approximately 1200 plants are documented in the literature, but more than 7500 medicinal plants have been identified in ethnobotanical surveys, which means we are underutilizing or overutilizing a few medicinal plants, and they are getting endangered. Whereas we have 7500 medicinal plants, commercially we are overexploiting 300 to 400 plants. Now this is again a gap. How do we fill this? Why can't we start using this entire medicinal plant wealth? So non-codified traditional knowledge is very rich. Now, see, most of the time the modern research on Indian medical heritage started in the pre-colonial period. Mostly Britishers started documentation, because earlier we used to have our samhitas and all that. Then there was a gap. After that, no new traditional documentation is now being done in a modern way. So during this period, few interesting things happened. One is Garcia da Horta. He was a Portuguese physician who came to India and made a pharmacopoeia in the 15th century of Indian drugs. He was very fascinated to see how Indian physicians were successfully treating so many cases. When the Portuguese came, they faced a lot of health problems, and many of these were treated successfully by local physicians. Inspired by that, Garcia da Horta created this pharmacopoeia. The second thing, what happened was the Hortus Malabaricus. Have you heard of the Hortus Malabaricus? Must have heard, yes. So in 20 volumes, I think it is there. The Kerala University has, published it now. The original copper plates are kept in Leiden, Netherlands. So this was an attempt by a Hendrik van Reed. He was I think a Dutch governor in Kerala. And he commissioned this work to a traditional physician called Itti Achyutan to compile all the medicinal plants used. His idea was to tell the Dutch government was planning to shift to Sri Lanka. He somehow wanted to stay back here, and so to convince his government that this is a place rich with all resources, he commissioned this Hortus Malabaricus, and that revealed the richness of the local traditions. So this Hortus Malabaricus is all about the medicinal plant wealth of Kerala, just Kerala alone, which is again different from Ayurveda. All these plants are not there in the classical Ayurvedic texts. So this means that people were continuously experimenting with the flora around them, developing their own knowledge, and which would gradually get endorsed, verified, and incorporated into the corpus of the Shastric tradition. It took time. Then we have in the colonial and early post-colonial period, it has been mostly Western scholars who looked at history of medicine. This was a period where Indian medical heritage began to get rediscovered, but many of them were very biased because they came with the idea that Greek medicine is the source of all medical knowledge in the world, and they wanted to show these systems as having developed later. So we have many controversial narratives also here about how the Ayurvedic Tridosha theory actually came from Greek system of humors. Tridosha came to be translated as humors, whereas there is a lot of difference between Greek humor theory and actually Ayurvedic Tridosha theory. The 3 doshas and 4 humors are very different. There is no vata in Greek system at all. And Greek humors are like fluids, whereas doshas are not, exactly fluids. So given those misinterpretations, in this period we found Indian authors trying to push the tradition as much as possible. They would claim it is 10,000 years old, 20,000 years old, and Western scholars wanting to date it after Hippocrates, so that they want to show that everything came from Greek medicine. The fact is that we cannot actually look into the mists of time. It's not going to be easy to actually trace the origin of Ayurveda. I think it doesn't make sense to go into such arguments. If we know what the system is worth for, we can use it. That is more important than saying which one is old. Just because something becomes older, it doesn't become, as Kalidasa pointed out, doesn't really become better. Then we have early post-independence period where we had Rodolphia, Serpentina, Jeevani, and all these things. So you can see the landscape of research of traditional medicine has been evolving from historical documentation to historians' viewpoint to ethnobotanical research. Now we have, in the late era of modern research in Ayurveda, a lot of effort is happening. Have you heard of the TKDL, Traditional Knowledge Digital Library? Because when at one point Indian turmeric neem, there were patents filed in the US. So R.A. Mashelkar, the then DG of CSIR, he challenged these patents, and we won. Actually, all those patents were revoked. And then when he approached the US Patent Office objecting why these things are happening, the Patent Office said we need information to cross-verify whether these claims are prior art. And so the government of India initiated the TKDL project, where information from all this traditional knowledge, documented knowledge, is made into a database. So a patent office will now have access to this database. So if anybody makes a claim on a particular plant, they can cross-check with this database, and if any information is seen already documented, the patent will not be granted. So this is a big initiative taken by the government of India to protect traditional knowledge. This is also important because with modern technologies, people can come read an Ayurvedic text, pick up some information. With that clue, they will develop a new technology, and we may lose all this knowledge. Then this is the time R.A. Mashelkar started the golden triangle approach that I was mentioning earlier. Then we have post-modern initiatives, where now people are beginning to say that Ayurveda needs its own research methodology. It's not just about evaluating it. One of the biggest initiatives that happened in this period is from Professor M.S. Valiathan. M.S. Valiathan created a science initiative in Ayurveda, where Ayurvedic concepts like Prakriti, everybody is having a different constitution. He was trying to validate, instead of just testing a few medicines, whether the theories of Ayurveda are themselves valid. So he brought Ayurveda physicians and modern scientists together and conducted a series of studies across India with funding from the Prime Minister's office, and all of them have led to very interesting publications. So this is how slowly we have been evolving and developing, but the efforts that we actually need to capitalize on our medical heritage is still, at its infancy. And that is why FTPs like this and initiatives by UGC spread more awareness. So everybody doesn't have to study Ayurveda to develop this. In any field, if you have that idea, even modern scientists and researchers who study science, who study engineering, who study biology, if they have some Ayurvedic background, it may help them to get clues and develop new innovations, and that's the whole idea. Now the last part, I don't know how much time I have, we'll go through this quickly, is the third part of our discussion today, is India as a Arogyasamskriti. This is also not about Ayurveda. Whatever is related to Ayurveda, I'm going to discuss only tomorrow. Today is about Indian medical heritage other than Ayurveda. So Sanskrit literature is enriched with profound insights about health. Not only Ayurvedic literature, if you study Sanskrit literature, you will get a lot of knowledge about health. So India was a Arogyasamskriti. You cannot come out of Mahabharata without getting some awareness about health. Have you heard of this usage, Ayur Arogya Saukhyam? It is not from Ayurveda. It is from Narayaniyam. Narayaniyam is a devotional, masterpiece. Narayaniyam ends with the statement, let the Lord bless us all with Ayur, Arogya and Saukya. It's a very profound idea of the concept of health. So we will explain that. So Muhlenbelt was a Western scholar. I will talk about Muhlenbelt tomorrow, who made a very monumental contribution in creating a whole compendium of the history of Indian medical literature. So he made a list of 132. He was collecting information from Ayurvedic texts, and he accidentally found that non-Ayurvedic texts are also a good source of health information. So he made a list of 132 texts. We are doing a project now under ICAS where we have compiled from more than 250 texts health information. And in the remaining time, I'll try to give you a quick glimpse of what this information and is about. I don't want you to read this. I'm sure you are not expected to read this slide. It is just to show some of the texts. This is from the index of a book. These are all non-Sanskrit textbooks, non-Ayurvedic textbooks in Sanskrit. Okay. Sorry. So this includes, all genres. If you classify, I'll show a chart again, which is not readable. I'm sorry, our charts are so much of information that it's not possible to make it readable on a PowerPoint. If you classify Sanskrit Vangmaya into different categories, Paravidya, Kavya, Shastras, Veda, Vedanga, we have the classification. Under every category, whatever text you take, there will be some information on health. Which means anybody getting exposed to Sanskrit literature will get sensitized about the importance of health. Now this is again another slide which you cannot read. This I hope you can see the classification. All the black letters are names of texts. The red is the category. So under every category there is a text which has some information on. So it's not just a few textbooks that have information on health. The entire Sanskrit Vangmayam is. So on this basis we are making a claim that Indian civilization was an Arogyasamskrti, because we tried to promote the awareness of health through all. So dissemination was widespread. I tried to present it in two ways, but still, you'll have to slice it into different segments, but then we will not get the whole picture. So now Non Ayurvedic Sanskrit Literature was a medium for dissemination of health information. And we did a research, we made a word cloud. So we took information from these texts and categorized them into controlled vocabulary, made keywords. And if you make a keyword out of this, the categories of information that is available, this is how it comes. And what is interesting is that it looks like alcohol abuse was common in those days also. A lot of effort is taken in these Sanskrit books to educate people about not drinking alcohol. The Bhagavatam also is telling Loke Vyavaya Amisha Madhya Seva. Vyavaya, Amisha and Madhya Seva is Swabhavika. People eating meat, indulging in sex and drinking alcohol. So it is very important to help people curb this. So through health education this was done. Today also we know drug abuse, all this is very rampant. So this is a perennial problem. But the interesting thing is that you can see what are all areas alcohol is standing out, in the word cloud formation as a very prominent topic that you see across the text, Smriti, Shastras and all those things. So we found 30 to 40 major categories which covers most of the important topics that are needed to educate the public about preventive health and wellness. That is there in these textbooks. So only a fraction of the medical manuscripts in India have been studied and systematized. Do you know that only less than 10% have been studied? 90% of manuscripts are in libraries under lock and key. If you go there, they won't allow you to look at it. It's so difficult to access a manuscript. So preserving manuscripts means putting it into museums, not reading or making use of it. This is something that we have to. Today we have the technology. I mean, we could use OCR technology, maybe even advanced technologies to scan these manuscripts, convert them into machine readable formats and start translating it. We would be able to get a better idea of the wealth of knowledge, because this is what I found. Medical knowledge in India is like a jigsaw puzzle. Bits and pieces are scattered, across sources. We have to bring them all together, and this is big data business, which means we need a computational platform to bring all this together and then put the pieces together to get a bigger picture of what is actually happening. So Ayurveda in Mahabharata is this, you need a little knowledge of Sanskrit to understand. Shitoshne chaiva vayuscha traya shariraja guna tesham gunanam samyam swasti lakshanam. Health definition is given in Mahabharata, both physical and mental health. So what the Mahabharata says is, physically if you are okay, it is a state of health, but if the person to be actually called healthy, they should have mental health also. So if you have triguna balance in the mind, you are a swastha. Your body is healthy, but you are still not healthy unless you also become mentally healthy. So deep insights, just you can see the two terms here, swasthyam and swastha. Swasthyam means the state of swasthyam. So physical health still does not qualify the individual to be called as a healthy person unless you are mentally also healthy. Now what I found is that in our non-medical literature there's a lot of aspiration for medical technology. So I was also always confronted by this ethical question, because today science and technology is developing so much. We have even artificial wombs now, So is it ethically correct or not? But if you look at Mahabharata or some of our Puranas, they were already thinking of all these technologies. So I don't think we were in principle against any technology. Only it has to be used appropriately. So you have birth myths like extrauterine fertilization, extrauterine gestation, cloning of fetuses, surrogate mothers, external influence, how the fetus can be influenced during the intrauterine life. All these things are described not in Ayurveda but in the Puranas and other epics. Even asexual reproduction. This was a big question that is repeatedly being asked in our tradition. Modern science has not been able to create an artificial cell. Life can be propagated only from pre-existing life. But we have stories like Parvati and Agastya creating life from inert matter. So they were also experimenting that. They thought of those possibilities. So I would call these as actually science fiction. Please don't misunderstand. I'm not making a claim that these technologies existed, but an aspiration for such technologies existed. Science fiction is also an indication of how people think, how they looked at these possibilities. Today we know all what was science fiction in the Puranas. So even the Vimana is like that kind of a science fiction. They imagined air travel. I don't have enough evidence to say that it really existed. Because plastic surgery, we can say that it really was done because the actual procedure is mentioned and we have proof that it happened. But these kind of technologies we don't have. Now another thing which you can see is dead body preservation, reviving dead with special herbs. Today I have documented actually a lot of stories where dead people are coming back right from the coffin, sometimes while the funeral is in progress, because death is not something which is very possible, easy to predict. So in Ayurveda there is something called as Kala Vanchanam. Even when you have snake bite and other things, the Vaidyas, a person who is apparently dead may not be really dead. So there are methods to see if they can still be revived. And this has happened. I keep collecting such anecdotal, they're not anecdotal, they're actually documented instances where a doctor may have pronounced a person dead, but then they wake up. Some of them again die after a little while. So the fact is that medically we are still not reached a point where we completely can make a judgment between a person whether he is living or dead. There are also fancy ideas about restoring youthhood. All these things I would put under science fiction because they are not easy to reproduce. But as early as the Rig Veda, there is a account of artificial limbs, prosthesis. Queen Vispala, this is interesting, it's a woman, a queen is fighting a battle and her limb gets severed. She goes back, comes back with a metallic limb and then continues to fight. So Ayasim Jankam, it is said in the Rig Veda actually. So in Rig Vedic times they were thinking about prosthetic surgery. Then we have head transplant. So for all the transplants, they were interested in head transplant, not other organ transplants. They also talked about eye transplant. In Charaka Samhita, there's a discussion of artificial denture, eye transplant. So I know that now in Italy, there's a attempt being made to do brain transplant. And I think in monkeys they are doing some experiment. But at least the first idea that head transplant could be done, but this is across species also. So all this is more aspiration than actual, So there are also interesting research myths. How they taught students. I don't know if you have heard of the story of Jivaka. Jivaka was the disciple of Atreya. So at the end of the study, the teacher tells, only those of you who will qualify, who pass this test. Teacher asks the student, go around, get a plant which has no medicinal use. Everybody goes out. Jivaka alone doesn't return. After many days he comes back. Everybody came back with one plant or the other saying this does not have medicinal value. Jivaka returns and the teacher asks, what took you so long? He said, I couldn't find a plant that does not have medicinal value. And then the teacher says that you are the only person who passes this course. So they had unique ways of testing, very practical approaches. There are other stories also about how a student was chosen to be a physician. Nagarjuna once announced that he is going to take disciples. So two people came. And then Nagarjuna said, I'm going to make a rasayana, a medicine. It's very difficult to make. Please observe. You have to go back and repeat the process and come next day. So he demonstrated how it is to be done. Then both of them went. Only one person came back. In all these stories, it's very similar. One person came back with the rasayana, the other person came empty-handed. So Nagarjuna first looked at the rasayana and he said, this is done very nicely. You have observed everything. And he asked the other person, why did you not come? Why did you not make the rasayana? So he said, the moment I went out of your home, I saw an old person. He was in a very bad shape. So I couldn't ignore him. I had to take care of him. And by the time I made him comfortable, all my time was used up. So I couldn't, do it. I'm very sorry. I just came to give company to my friend. And then Nagarjuna just thought for a little while and said, you are the one I'm selecting to be my student. So he said, the point he said was that medicine is all about empathy and not just about skills. I can teach you how to make a rasayana, but I don't know how to teach empathy. So you already have the quality. So these kind of interesting stories abound in our tradition, which gives us a very interesting perspective, for education, how education was done and all that. So this was also talked about, one health, planetary health. If you look at it, this is the theme in the Vedas. The Purusha Suktam you must have heard. The Purusha Suktam begins with a Shanti mantra. Om Tachamyo Ravrani Mahe Gatum Yatnyaya Gadum Yatnyapadaye Dvaivi Swastirastuna Swastir Manushebhya Urdhvam Jigadu Bheshajam Sham No Astu Dvipade Sham Chatushpade. So here we are talking about planetary health. The whole idea is that if the planet is not healthy, we will not be healthy. If the plants are not healthy, we will not be healthy. If the animals are not healthy, we will not be healthy. So even this was integrated into our day-to-day life. Even when we chanted a mantra every day morning, we were visualizing, one health. So I think this is amazing. I mean, this kind of integration of health concepts into the whole fabric of human life, I mean, this is very unique to the Indian civilization. So we have on food, how to eat. Eating was a very important, it's a very important aspect of life. So a lot of effort was done to create awareness about good eating habits. Ajavat sarvanam kutiyat. Chew like a goat. You must have seen how a goat chews. I mean, now we are not seeing goats most of the time. Even in my younger days, we used to always see, goats in homes. So another thing is like Jataram Pure Dartham. These were all popular verses. Everybody knew this. Pane Negam Prapure. Vayo Sancharanarthaya Chadurtham Avasheshe. Always a lot of debate on whether we should drink water while we eat food. Ayurveda very clearly tells 1/4 of your stomach should be water. So which means you have to drink a little water when you are eating food. Half only should be, so filling the stomach to half. This was a very important concept, not to create, So then there are other interesting things. One idea is, this is very recently discovered by modern medicine also. So Bhuktoba Vishadas Thaulyam. If you eat meals, so this was a good formula today, eating a heavy meal and coming and sitting here is supposed to make you obese. Shayanasya Rujastada. If you lie down after eating a meal, you will become sick. Ayut Chankramana Manasya. Those who move around after eating food, their health and longevity will improve. Mrutyur Dhavati Dhavata. If you run, then death will come behind you. So now what is interesting is, there are very detailed descriptions, like these kind of information you can see in Non Ayurvedic Sanskrit literature. Bhuktva Shatapadam Gatva Vama Parshvena Samvishet. It is said that after eating, you must walk for 100 steps and then lie down on your left side, because that is how you are. So it's explained. With an understanding of the anatomy, they have explained this. Bhuktva Rajavadasida Yavad Annaklamo Gadam. That is, after immediately eating, feel you have what is called as a tiredness from that eating. So till that is over, you are allowed to sit, and then you must walk. So in this way you can see a lot of detailed advices and descriptions. What is interesting is that in just last November there was a study which said research shows that a short walk after eating a meal prevents your blood glucose from spiking as high as it would if you ate and then stayed sitting. So this keeps your insulin levels stable. Now this is the new finding. It is only in 2023 that we are talking about eating and walking, but this is a practice that was advised by all our Puranas, all our Shastras since thousands of years. So if you take some of these practices, do some modern studies, maybe we will be able to discover a lot of interesting things about good health practices. So we have a whole tradition of cooking in ancient India, and the whole idea is that food should be, I see the time, yeah, so another 5 minutes and we will stop. Food should be delicious, nutritious and assimilable. This is what Ayurveda considers as a proper diet. Food should be delicious, but the problem is if you make it delicious, then it is no longer nutritious. If you make it nutritious, then it is no longer delicious. But Ayurveda says that you cannot always get both the two. Sometimes by practice, even a food that is not delicious can become delicious. I don't know if you have heard of the story of this sannyasi who did not like bitter gourd. So if he was served bitter gourd, he would eat it first. Then the word spread around that this sannyasi likes bitter gourd. So wherever he went, everybody would serve bitter gourd. Now being a sannyasi, he has to accept it. So it so happened that after a few months, it became its favorite dish. It really became its favorite dish. So Ayurveda also tells us that sometimes deliciousness or nutritiousness is also, something that comes from your mind. The idea is that you must enjoy the food that you eat. So in India we have huge wealth of resources. Bhojana Kutuhal. These are not exactly Ayurvedic texts. And Pagadarpana of Nala is a very interesting book on cookery. And our idea was males are best cooks. Most of these cooks were males. But women should serve the food. Food should be served out of love. So we had the concept of Annapurneshwari, that always you get the food, Bhiksham Dehi, get the food from a woman, because food should come from motherly love. But males should be in the kitchen doing all the cooking. And so King Nala was one of the best cooks. He was a king. And because of his cookery skills, he was able to get refuge in another kingdom. He went there, and when he introduces himself, he's telling about his cookery skills. I can cook this meat, I can cook that dish. And then the king says, okay, get him into my kitchen. That's how it starts. So all these interesting cookery books are there. So as I said, Ayurveda wants to keep, our health culture wanted to keep the doctor away. And Ayurveda is very clear, eating an apple a day is not enough. Just with an apple you cannot keep the doctor away. Our version is Parishramo mitahara bhugada vashwini sudau tavanadritya naivaham vaidyamanyam sramashraya. Parishrama, being physically active. Mitahara, having moderation in food. These are the two things which can keep you away from the physician. So it is said, Vaidyanam hitabhuk midabhuk ripuhu. A person who is eating moderately and is physically active is an enemy of a doctor, because they won't need to see a doctor. Shakyadepya annamatrena narakartum niramaya. So these kind of concepts are widely publicized. If you eat food properly, you won't need to see a doctor. How to avoid a doctor was a major theme in all these narratives. So I want to also highlight another aspect is exercise. So we always advise moderation exercise, and I am reminded of the importance of this teaching when you see a lot of people today dying in gyms, and while they are physically active, people are getting it completely wrong. So if you look at Ayurveda, we have a very good advice on how to optimize exercise. And one of our researchers who are working in the IKS team, she was working on a book called Malla Purana. Malla Puranam is a textbook which is not an Ayurvedic textbook, but which gives you such a detailed narrative on how to do exercise. very ultra modern concepts of grading exercise into moderate, severe, how according to different individuals exercise can be modified, how to measure whether the exercise is moderate or, so those things are there in this. Finally, health was considered as really wealth, as we call it. So this great awareness, ekatas kratavas sarve sahasravara dakshina anyato rogabhidanam praninam pranarakshana. On the one side is giving health to people. On the other side is sahasra varadakshina is something which the bride's father gives to the bridegroom. So giving health to one person is like giving 1000 varadakshinas. So if you can just contribute to the health of a person. So they are very iha chatvari danani proktani paramarshabhi vicharya nana shastrani sharmanetra paratracha bhidebhyascha abhayam deyam vyadhidebhyas tadaushadam deya vidyarthine vidya deyam annam shudhadune. 4 things if you do, you don't need to do any other puja or any other ritual. 4 things. Bhidebhyascha abhayam deyam. If someone who is seeking refuge out of fear, if you can give refuge, you have done the greatest punyam. You don't have to do any sahasranama or go to any temple. The second thing, vyadhidebhyas tadaushadam. If you give medicine to a sick person, that is enough. That is enough merit. Or deya vidyarthine vidya. If somebody is coming for knowledge and you give the knowledge to that person, that is also enough. Or deya mannam chudhadure. Giving food to a hungry person is also equivalent to. So akashasya athananta surairappavigamyate tadvad arogyadanasya nanto vai vidyate kuchit. There is no limit to the merit of giving health or. So what was understood is that in those days, this what you today